Good evening, folks. Welcome to another session of Alleviate at 8. Nice to see some familiar faces gathering and some new ones. And a reminder for people who are new, we do record these sessions, but we only record the speakers. So I actually think it's nice if you can keep your video on, because it's good to see each other. It sort of builds that sense of community. Of course, you're welcome to leave it off if you prefer, but you can turn it on and you can be confident you won't be recorded, because we do actually post these sessions so people who can't actually join us live can catch up with them a little later. And if you've been coming off and on, or just joined us recently, some of those previous recordings can be quite useful, and they've got headings there. So if you've got a particular exercise from Alleviate that you're finding helpful and you'd like some guidance on it, you can refer back to that. And usually each time we do a session like tonight, as those of you who've been around for a while know, we do a little introduction. And tonight we're focusing on pain management. And I must say, this is an area I'd really like to see taught in schools. I know I can speak from experience with my own children that we taught them these skills as they were growing up. And it's not just the capacity to deal with the sort of physical pain we normally think of when we think of pain, but it actually generates a capacity to deal with difficulties across the board. You know, there's a lot of things in life that are painful for us, aren't there? There's emotional pain, there's mental pain, there's even spiritual pain. And being able to experience that in your own life without having to dull it down or distract yourself or use drugs or things like, drugs like alcohol or smoking, is a really valuable resource. So, for those of you who've got younger children, these are skills that you can teach them fairly easily, actually. It's disarmingly easy, in my view. And certainly for those of us who are older, part of what we face as we're trying to learn to manage our own pain better is just the community expectation that pain's a difficult thing. And in our culture, we do a lot to avoid it. Australia's good at a lot of things, and we're right up the top of the amount of analgesics per capita around the world, which is not something you might think of with Australians. We like to think of ourselves as being a bit tough and resilient, but actually we use more pain medication than just about any culture in the world, any country in the world. So Ruth's had a lot of experience with this. She's going to lead us tonight. And this is where I get to introduce the beloved, which is always a nice thing to be able to do. And from her background as a GP, and from her background as having given birth to babies and had the normal sort of pain things, and more recently she might like to talk about what's been going on in that part of her world. Ruth's had quite a lot of professional and personal experience, and for many years actually at the Gawler Foundation with our cancer programs, Ruth used to take the specific session on pain management and engage with people about the pains that they were dealing with, and help them with finding a place of inner peace amidst all that. So tonight we're really fortunate to be able to draw on all this experience. I hope you really enjoy it, and I know this is a really for some people, this sort of learning can actually be life-changing. So, Ruth, over to you. Thank you.
Thank you very much, Ian. And yes, it is true that I've been managing pain for long periods of time in my life related to back problems. And the pain has been sometimes very extreme. And of course, that brings up a lot of fear. And the fear actually makes the pain worse, because as soon as you're frightened, all the muscles in your body get tighter. And tight muscles are part of what makes pain even more extreme. So one of the methods we use for managing pain, which you'll see on the Alleviate app, is the deep relaxation. And I can highly recommend that as one of the techniques to have a go with. And as Ian, you quite rightly said, pain can be physical, it can be emotional, it can be spiritual. Pain can be of different kinds of pain. You know, we know that some pains are sharp and some pains are dull. And then there's the issue of whether it's acute pain or chronic pain, because there's no doubt that chronic pain very often does come into your state of mind and brings about a feeling of negativity about your life, and quite often a sense of hopelessness and a sense of kind of depression, I suppose. And so I think it's really useful to have something in your toolkit which works for you personally. And in the meditation arena, there's a number of different techniques. As I said, there's the deep relaxation. And there's also this wonderful guided imagery one that we're going to do tonight, which uses the very fact that we can distract ourselves from our pain, and it changes the relationship with the pain. So we don't expect that any particular outcome immediately, but what we do begin to feel is a sense of having somewhere to go, something that we can personally do in any situation which can alleviate the pain. So I'm going to ask you to keep an open mind. The possibilities are there for anything to happen in this meditation to you in terms of what you're experiencing. And in fact, not to be too limited in thinking that this meditation is just about physical pain, that it actually can have a much bigger impact if you allow it to be fully engaged with in terms of your imagination. We're using our imaginations now to take our focus away from the pain. So let's begin by just taking a few moments to settle into our postures. And some of you may like to be lying down, but it's fine to do this one sitting up as well. And take a few moments now to adjust your body back just as upright as you feel comfortable. And you'll probably find it best to have your feet flat on the floor, a little bit apart, hands resting on your lap, on your thighs. And you might like to lean back if you're sitting up and feel the support from the back of the chair. And if you're lying down, feel the support of what you're lying on. Feel the points of contact between your body and what's supporting you. Just notice what feels most comfortable for you. And then when you're ready, you might like to join me now and just gently close the eyes. Turning your thoughts inwards. And remember that this is a time when we can use guided imagery to experience a deeper, natural peace, for regeneration and healing, for finding comfort and ease, and moving gently into stillness. Now, a gentle reminder to yourself of why you're doing this exercise, what you're wishing for. But then aim to let go of any effort or struggle to make something in particular happen. Let us just do this together in an alert and relaxed manner, with a gentle curiosity. Now, in your mind's eye, imagine a place where you feel particularly peaceful and comfortable. It may be a place you've been to before, or it may be a fantasy place. Just allow an image to form in your mind of a place where you feel particularly peaceful and comfortable. And in a way that you can explore it in more detail. A place where you feel particularly peaceful and comfortable. And of course, you can make any changes to it that you'd like to in your own mind's eye. So what can you see in this place? What is close by? What is further off in the distance? What can you see? What shapes, sizes, what colors, what shades of color? What time of day is it? If you can see the sky, are there clouds or is it clear? You may notice some movement, or is it quite still? What can you see in this place? Now notice what sounds you can hear in this place. Are there any sounds coming from nearby? Are there sounds coming from further away? What sounds can you hear in this place? Now notice what you may be able to smell in this place. Is there a fragrance? What odor? Perhaps just the quality of the air itself. What can you smell in this place? And what sensations can you feel in this place? You'll probably be aware of the temperature. Is it warm or cool or neutral? Can you feel the warmth of the sun on your face? Or maybe you feel a breeze on your skin. Notice too your position and what you're in contact with. Is it hard or soft? Damp or dry? What physical sensations are you aware of in this place? And now, if there's anything you'd might like to change to make this place even more peaceful and comfortable, remember that you can do that. Even more peaceful and comfortable. Now dwell on the feelings that come with being in this place. Allow these feelings to build within you and rest with those feelings. Just simply letting go. Relaxing. Releasing. Letting go. And as you do relax even more, there comes a feeling of lightness. Lightness. Almost as if you could be floating up a few inches above the ground. Letting go. Just feeling the ease of it all. The ease of it all. And going with it. Going with it. Letting go into that feeling of relaxing, releasing. So effortlessly. Just flowing and resting with it. A melting, a merging, a oneness. So easy. Just feeling the ease of it all. Going with it. Going with it. And resting quietly now in the feeling of all this. Letting go. And from time to time, images may form in your mind of this place, remembering something, feeling something, and relaxing into the ease of it all. If at any stage you do notice your mind wandering or becoming distracted, as soon as you do notice that, gently bring your attention back to your inner sanctuary, this peaceful place. Remember it, imagining yourself in that place once again, taking it all in, feeling it all through, and maybe also lying down, relaxing. releasing. And that feeling of floating just a few inches above the ground. So effortlessly. Effortlessly. Just simply letting go. Letting go. And of course, other thoughts may come and go. Allow them to come when they're ready and go when they're ready. Remembering the place that you've chosen to be. Releasing. Relaxing. Letting go. Now bringing your awareness more particularly back to your body once again. Perhaps you take a somewhat deeper breath or two. You might like to move your feet a little, move your hands a little. And then when you're ready, just let your eyes gently open again. Good. So sometimes when we do this exercise, we find that the longer we rest in it, the more can happen sometimes in that inner sanctuary. Sometimes something actually occurs in our experience, and we just let that happen. Very often, the place we choose is some place that has some significance for us. It could be an imaginary place, of course, but often we do choose somewhere which has some significance. And so there can be sometimes a sort of welling of some feeling, perhaps tears can come to the eyes just remembering. And in this process, we really allow that to flow. We don't actually block anything. And there may be sometimes a feeling of release when we do that, which is actually very helpful for the body, helpful for relieving pain. So this technique is using the very good fact that the mind has so many different aspects to it that we can actually choose a particular place to put the mind, to put our thoughts. And in doing so, very often our concentration means that we've let go of our preoccupation with pain. And pain can be something we can become quite obsessed with and ruminate and continually analyze and try and work out how to change. So it's actually lovely to get a break from it. And that's one of my pieces of advice in this, that the meditation is one wonderful way, even just a short meditation, of getting a break from the pain. And of course, you may take some analgesia, some Panadol or aspirin or whatever you find helpful. These things can work together. It doesn't have to be one or the other. It can actually be a combination of things that works for you. And you have to really work with your own pain in any given moment where the circumstances are somewhat different, where the requirements are somewhat different. And the idea with pain is to be flexible, to be ready to try something different, to do something different, and to be very gentle and kind to yourself, knowing fully that you're actually doing your best, and it may take a little bit of time to see some results. So I'll encourage you with using meditation like this for pain. And the other thing about it is that you can actually, of course, choose an imaginary place where you put the factors that you like around you into the environment that you would like to be in. I've actually personally done this also with having somebody who I know is very loving in the place with me. And quite often that actually helps to augment the feeling of ease and being held, so to speak. So that's completely up to you. It's whatever feels right that actually works. So thank you for giving me the opportunity to do this with you. And I'm wondering if Kathy or Ian have any further comments about using this kind of meditation.
I'd certainly like to jump in if I could, Kathy. Ruth, thank you for a lovely session and for this really wise, heartfelt advice that you've added. I just wanted to say a couple of important things before we finish up tonight. And the first one was I noticed a couple of people joined later this evening after Ruth had started. And being a guided imagery exercise, if you come in late, it can sometimes be a bit disorientating if you haven't done the exercise before. If you're familiar with the exercise, it's I guess you can pick it up. But if you haven't done this exercise before, of course it is on the app. But also we've recorded tonight's session, so if you're one of those people who missed the first few minutes, you can pick it up. And Saurabh, can you just remind us, please, how people actually do that?
Ian, so this is accessing the recording.
Yep.
Yeah, Ian, sorry, do you mean on YouTube?
Yes, how people actually find it if they want to go back and revisit this recording.
Sure. So there's a channel for Alleviate on YouTube called Alleviate. And we also insert a link to that in every email that we send out for Alleviate at 8 reminders. At the bottom, there's a link there.
Okay, so it's simple enough, folks. And look, the other thing I was really keen to say was I'd really like to take the opportunity this evening to dedicate whatever benefit there's been in this practice we've done together tonight to the people all around the place who are in pain. And I guess we'll all be conscious of what's going on in the Ukraine and how those people are suffering. And I imagine many of them in quite acute pain, both physical, emotional, mental, and probably spiritual. But also there must be many families in Russia who've got family members involved in this conflict and are also being beset. But at the same time, we know there are plenty of other zones of conflict around the world, even here in our own country, in Australia, but I know other people from other countries join us. And pain can happen through all sorts of circumstances, whether personal, within the family, within the community, at a national level, like in the Ukraine. So I guess I'd invite you and encourage you to join me in a really strong wish that people around the world who are in pain might have the good fortune, like we have, to find something that does offer the possibility of, to use our word, to alleviate that pain, to actually help them to manage their pain. And I would really encourage you that if you are finding some benefit from this sort of pain management exercise specifically, to consider sharing it with other people who you know that might be going through their own distress at this particular time.
It's a particularly easy one, Ian. Excuse me for interrupting. It's a particularly easy one to do with somebody else who's in pain and to guide them through. And to help them if you really don't know how else to help them, you just ask them to close their eyes and you lead them in it. It's really quite a simple one because you're doing it in your own mind, in your own imagination, and you're guiding them in the same way.
Yeah, and very much this is one that you could do with children.
Yep.
We talked about how pain management in children's really useful, and you could certainly just turn the app on, play the app to children, even in bed at the end of the day. Great way for them to actually relax and find this inner peace. They don't have to be in pain even, but if they do have physical pain, it's a great way of relieving that. I know quite a lot of people who use this particular exercise in hospital settings or when people have to go through procedures, because it's a way of taking your mind away from the fear and uncertainties and the pain that those things can invoke. And then I also want to mention, on a completely different note, that there's a fairly critical time in the end stage, I guess, of the foundation I set up and have been involved with now for over 40 years. And I wanted to take the opportunity to mention it this evening, because I know I see many faces of people who've been involved with the foundation over the years. And there's a vote coming up on actually winding up the foundation. And people have been asking me and Ruth how we feel about this and what we suggest around it. And I just think it's useful for me to say, and I respect everybody's got their own views on this, and you'll do what feels right within your own integrity. But I certainly feel that at this point in time, it makes sense for the foundation to be wound up, and I think from what I understand of it, that's going to be best accomplished by appointing a receiver. And for those of you who are members, there's a voting form being sent out. And then the big question is, well, what happens to the residual assets of the foundation? And the main one, the main one as a fact, is the Yarra Valley Living Centre, where many of you might have been. And it would be really nice to think that all the energy, all the goodwill, all the good efforts of so many people over decades that have been put to good use in that place, and all the benefits that people have felt going to that place could be continued in some way. And in actual fact, there's only one group that's shown a real interest and commitment to doing that and the capacity to do it, and that's a group called the Brahma Kumaris. They're not a group that I'm directly involved in the sense that they're a spiritual group, and it's not my particular path. But I have known these people for over 40 years, and I have the utmost respect for them. And I've really admired the way they've actually conducted themselves in leasing the property over the last 12 months. Some of you all know that they've been leasing the property from the foundation these last 12 months. And personally, I would like to see all efforts made to ensure that they can actually take ownership of the property and keep it going. They're an organisation that's quite large. They've got centres all around the world. And one of their remarkable features is they don't pay anybody to do anything within their organisation. I'm sure they hire consultants to do external work at different points in time, but they're a completely voluntary run organisation. Many people actually give their lives to trying to help other people through the organisation, and I feel that they've got the best possibility of carrying the energy of the foundation forward. It'll obviously change, and to be blunt, I think it's a bit of a tragedy that it's come to this, but that's what it is. It's sad, and many of us are probably feeling our own versions of grief and sadness, disappointment around that. But things change. I would like, seeing I've got into this chat, to acknowledge just the hundreds, thousands of people who actually worked really hard, either on staff or as volunteers on the various boards, all the people who gave money, time, energy to the place, and enabled some really extraordinary things to happen in that place over the years. Many of the things that we did there were pioneering. They were innovations when we started them back in the 80s, 90s, even 2000s. And happily, many of those things have become mainstream. So many of the things will be carried forward. And actually, the thing that's probably most likely at risk of not going forward is the spiritual aspect of healing. And that's one of the reasons why I'm also keen for the BKs to Brahma Kumaris are known as the BKs, to carry it forward, because that's their thing. They're a spiritual organisation.
Can I add something here?
Please.
They are running retreats currently at the Yarra Valley Living Centre, and you just put Yarra Valley Living Centre into Google or whatever browser you use, and you'll see the retreats that they're running. And I can say that I would love to go on those retreats, because I know they know what they're doing, and their food is fantastic. It's really very much the diet that we used to promote and used to eat at the foundation. And the people that are there are actually doing everything they can to do things in the spirit of the Gawler Foundation. So I would say that the advantage is also that they modify their fees according to people's finances. In other words, it's a fee that's partly on in a sense a donation that you make, that you can afford, and that is much more flexible than it used to be.
Ruth, can I just clarify that? The BKs themselves actually never charge for anything they do. They only charge if an organisation actually hires their premises and actually has a fee. And they actually encourage external organisations to do it by donation. But the BKs themselves, if they're running their own retreat or putting on an event, and they put on some huge events, they never charge. It's all by donation. And that's
wonderful.
100% consistent. And it's one of the things that, is very appealing about what they do. So look, I thank you. I'm sort of I felt it important, because for those of you who are members, there's a voting form that's gone out, and a notice of a special meeting to resolve all this. And I would encourage you to do what I'm doing, which is to vote that the foundation do be wound up and placed into receivership, and that the residual funds go directly to the BKs. The voting form is a little confusing, but I'm happy to say I didn't put it together. I haven't had anything to do with this. I haven't been involved on the board there for years, or been a member of staff for a long time. But there are 3 organisations that have been suggested as options. The Shake It Up Foundation, which does neurological work, the Peter Mac Hospital, and the Brahma Kumaris. And to be clear, I don't have anything against the other 2 organisations, but I'm really keen that the funds don't get dispersed, don't get diverted, and that it's made possible for the BKs to actually take control and actually own and use the foundation well. So I would encourage you to vote no to the other 2 and yes for the BKs. But it's up to you. And if you're not a member, if you're not sure if you're a member,
they can email us, Ian. I'm quite happy if anybody emails iangawler.com. There's a message place you can put a message, and I'll assist anybody who'd like to know.
Yeah, and send your the votes have to be in by Friday of this week. That's why I thought I should mention it tonight.
Yep.
So thank you for listening to that. Those of you who stayed on, I would just go back to where we started, which is with this pain management exercise that Ruth led us through so beautifully this evening. I hope you find that place of inner peace. I hope you find that imagery exercise that she's led us through tonight helpful. And we'll see you again in a week's time. Have a good week.
Thank you, Ian.
Thank you all.
Good morning, wherever you are.
Thank you, Ian.
Your lovely feedback, folks. It's very encouraging.
Thank you, Ruth. Thank you, Ian.